Northern Ontario. I'm the Director of Lands and Resources, and we are thankful that you are here to hear the story that we want to present to you, to the media, to the country, to the world, about the failing infrastructure conditions up in Kashechewan First Nation. And we have representatives here. The Chief of Cash is not here today, but we have our Grand Chief and Deputy Grand Chief. And I'd like to introduce, first of all, Grand Chief Leo Friday. He also originates from Kashechewan First Nation. He's been a chief there, and today he's the Grand Chief of the whole council, which represents 7 other communities throughout our territory. So at this point, I'd like to ask Grand Chief Leo Friday to come and make a statement. Oh.
Mingwech misoe gabeche tagushnik gabeche dottamek tanes palak andettaunana mittenita we alamigo dugamakanam elugo kabatso nesta muna luego maka kagikepen balnuta batiswen annos kachushkipi punnigocha I just wanted to say thank you to all of you that come in and those of you that listen from home and from your own communities and cities. I just wanted to share with you that our chief is working really hard since the beginning of this month, the new year. And he hardly rests. He barely sleeps because of all the action that's going on in this community. And it's really serious of what's happening in our community. And I stand here with Hosea Wesley, Chief Hosea Wesley, the council and the people of Kashechewan. On January 4, 2026, Kashechewan declared a state of emergency because of the complete failure of water and wastewater system. Sewage flooded the nursing station and also the water treatment plant, making it unsafe to use or drink the water. Families, elders, and children do not have safe drinking water. Fire hydrants are all frozen. The community is not safe to live in. This is the serious public health and safety emergency. Ontario and Canada have failed to invest in a long-term solution. Government focus only on resources, industries, and select communities, ignoring the real needs of our people and communities. The federal government says Kashechewan does not meet the criteria to military assistance. We strongly disagree. This is the real emergency that's happening right now. And you people need to help us. We need your voices and your strong support to help our community needs. We were promised to move in 2005 and also in 2016 and also in 2017, but there's no actually any serious commitment from the government. And now we've been evacuated yearly, sometimes twice in a year. And because of the lack of standards of our firm, it's the reason why we've been evacuated. This is the real situation and the real emergency that we encounter. And our people need to help now. We need to help them now. Our communities are not coming cap in hands. This is about treaty responsibility, nation to nation relationship, and the government accountability. If government wants roads, ports, and access to resources, they must also address our priorities. Our Ontario government doesn't support our infrastructure, only Canada, and not enough. Kashechewan cannot rebuild in the same place. It must relocate to a safe site and dry high ground. We need new homes, safe water waste system, and a function clinic. Evacuation is not a long-term solution. Relocation must be fast-tracked. The government must provide real and long-term investment, not temporary band-aid fixes. Kashechewan is not an exception. It is warning. Ontario and Canada must respond now. Invest in our community and respect treaty obligations. This enough is enough. Thank you.
Thank you, Grand Chief. To make a secondary statement, I'd like to call upon Deputy Grand Chief Amos Wesley.
Mi Wesley no Mr. Tamek, especially in the Nation, the town of Mehochi, Kashechewan First Nation, Hatik. The Mammoth in the Malcolms and the Chief Jose Wesley, Mr. Wugamahanisik, Mr. Manny Mammoth in the Malcolms in the Hagigatoragalajik, Timmins, Kapuskasing, Kingston, Niagara Falls, Haitajik. The evacuation is still in progress, but it is moving too slowly. Only a fraction of 2,300 members have been moved so far. We need more planes from Ontario and Canada to evacuate everyone safely by Sunday. Requests for military assistance have not been fully met. The urgency is real. It must be recognized. We are asking public health officials to increase water testing to ensure residents are safe, especially with E. coli concerns. We now know 2 cases have been confirmed. The clinic faced sewage flooding and water damage. It cannot operate fully. Only emergency services are available. High-risk residents need safe care and evacuation support. Timeline for full clinic operations is unclear. Interim solutions are needed. Fix the water plant so it will not fail again. Ensure a fail-safe system. Provide training and resources to maintain it. Bring vac trucks and monitoring equipment to protect community members. Chief Hosea has been in contact with Minister Gayline about evacuation and support. This Thursday, Alvin Fiddler and Chief Benedict of the Regional Chief of Ontario will visit Kashechewan. They need to see conditions firsthand. They must recommit to relocation and long-term investment. We need governments to fast-track relocation for Kashechewan. Provide long-term investment in water, wastewater, housing, and health services. Include all Mushkegowuk nations along the coast in planning and decision-making. Stop relying on temporary band-aid solutions. Miigwech, thank you.
Thank you, Deputy Grand Chief. To close off the statements for this morning, I'd like to ask again Grand Chief Leo Friday to close it off.
Thank you, Lawrence. We are, the First Nation of Kashechewan, were ready and always were. And we are ready now to work with Ontario and Canada. But we will not be ignored. Please don't ignore our community again and again. Our communities are not here to be kept in hand. These are real, urgent issues that requires investment and long-term planning. We've been talking about the relocation for many years now, and nothing has happened. If the government wants ring of fire, access roads, and ports, they cannot have them without addressing our priorities first. Our community needs safe water, housing, functional clinic, and safe and strong infrastructure and long-term investment. Stop the neglect, invest properly, work with us, and we will work with you. Thank you.
Thank you. That will conclude our statements. We are ready for questions from the media. There is a microphone there. If you go to the microphone, identify yourself, and then we can go from there.
Hi, thank you for taking our questions. Jillian Pfeiffer with Global News. I was just wondering if you could give an update on how many citizens have been evacuated and how many are left in the community right now.
Can you scale 10 on that?
No, yeah.
What up?
668 as of yesterday.
I said you.
Hi. From the report that we had yesterday, there were a total of 668 people that were evacuated so far. So there must be around 1,600 to 1,700 people left in the community.
Can you speak a little bit about the last time maybe that you or someone from your community spoke to the federal government? Has anyone spoken directly with Minister Golmasti?
Chief Hosea Wesley spoke with Minister Golmasti on this past Tuesday, and she was very supportive of the evacuation that's taking place.
And do you know anything more about the details of that conversation, whether the government committed to anything?
I don't know the details of that conversation between Chief and Minister Golmasti.
Are there certain guarantees you'd like to see from the federal government?
I would like to see some concrete solutions for the community in terms of being a functional clinic, a functional water treatment plant. Especially Kashechewan, as you all know, is one of the most evacuated communities in all of Canada. And it's annual. And most long-term solution that Kashechewan needs is relocation. Thank you.
Hi, First Nation Bacon News. I have talked to the government a bit back and forth, and they are helping with the evacuation, but can you tell me what more you would, I guess, the community needs to, in terms of evacuating people more quickly?
I don't know what's wrong with the government in terms of urgency and a fast track of evacuation. January 4 is about maybe 10 days ago, and only 668 people were evacuated so far. We ask, our chief asked for expedite evacuation because of what's happening and what's going on in the community, and his heart with his people. If something happened to them and there's no health clinic or nurse to see or doctor to see. So we're stuck with helpless community. So I say that we ask and they ask for Hercules to airlift them from the community to a better, safe place. But Canada and Ontario denied. We ask for bigger airplanes, bigger than Dash 4, Dash 8, but no ultimate agreement from the Canada and Ontario. So we continue to use, you know what happened after they asked for that urgency for planes to come in? The smaller planes came in, like nine-seaters. They were used 37-seaters and 41-seaters, and after they asked for Hercules and bigger planes, they were sent these smaller planes, like 9-seaters. I don't know what the government is trying to do to us. Anyways, that's the short answer to your question.
The next question I had is about the health, I guess the nursing station or health services. According to ISC, they told me they've been moved to the school, but it sounds as if people aren't able to access regular healthcare service. Is that correct, or what's going on there?
Yes, that's correct, but you know what happened? Where they were sent to is an all-away without telephones. And the way that the nursing station works in our community, the nurse assesses you, and that assessment is phoned into a doctor, and the doctor gives advice to the nurse to do this and that, and give some kind of a remedial situation like Tylenol or something else, what they have in the community clinic. Yes, that's true, but they couldn't really not acceptable or really work if something real serious happened, like accident, heart attack, or some kind of complication of diabetes, and we have a lot of that.
Hi, Alessia Vesopini with the Canadian Press. I can't remember which one of you, but one of you mentioned during your opening remarks that the government said the crisis going on right now doesn't qualify for military assistance. Can you explain to me why or what they told you about that decision?
From the start of the declaration of emergency, the chief and council wanted military assistance from the government so they can expedite evacuation. And it wasn't really met, and people are still getting sick in the community because they are left there and because this evacuation is taken too slow. And since 668 people have been evacuated for the past 10 days since it was declared, we still have 1,600 or 1,700 people left, which are still facing unsafe drinking water, a non-fully functioning clinic. Thank you.
Hi. Sorry, I'm just wondering, I think one of you earlier mentioned that there were cases of E. coli confirmed. Were those individuals that were the confirmed cases moved away from the community? Are they able to access healthcare right now?
Hi, the two people that have confirmed to have E. coli were already outside the community. They had to go to these clinics because they were feeling sick, and that's how those two people have confirmed to have had E. coli in their urine samples.
Thank you.
Thank you.
All right, if we don't have any further questions, we thank you for your participation. And hopefully other people will be able to assist the community in this regard. It's a common issue amongst First Nation communities across the country, as you know. And we hope that the partnership with the treaty people and First Nations communities and the government will actually come to some positive solution at some point soon. A lot of
All right, there you have it. I hope you'll leave your comments. Thank you for joining us and have a good afternoon.